The second important component of the craniovertebral joints is the atlantoaxial joints. In this session, let's try to learn about the anatomy of the atlantoaxial joint. We'll try to learn about the anatomy of the atlantoaxial joint under the same headings, the types of atlantoaxial joints, and then for each type we will try to learn about what type it is, what are the ligaments, what are the movements that occur here, and what muscles are responsible for these movements. Let's talk about the anatomy of the atlantoaxial joints then. Atlantoaxial joints, as the name suggests, are the joints between the axis vertebra and the atlas vertebra. The joint occurs at three places, one in the median plane and two in the lateral plane. So we have a median atlantoaxial joint and then we have two lateral atlantoaxial joints. So let's try to learn about the median atlantoaxial joint first. Again, what type of joint it is, what are the articular surfaces, the ligaments, movements and muscle responsible. What type of joint is median atlantoaxial joint? The median atlantoaxial joint is a pivot joint. So it's a synovial joint of pivot variety. The articular surfaces, as we can see, are formed by the dens or the odontoid process of the axis and the anterior arch of atlas. The anterior arch of atlas on its inside has a smooth facet for articulation with the odontoid process or the dens. This is regarding the type and articular surfaces. What about ligaments? The first ligament, of course, we have is the capsular ligament. Capsular ligament will enclose the articular surfaces. But most important ligament that we must know here is the transverse ligament of the atlas. The transverse ligament of the atlas will complete the formation of the ring within which the pivot of the odontoid process or the dens will rotate. Right? So the transverse ligament of the atlas is attached along the margins of the anterior arch of the atlas and this will enclose the odontoid process of the dens, completing the ring within which the odontoid process will rotate. Apart from the transverse ligament of the atlas, the other ligaments that are important are, one is apical ligament of dens. The apical ligament of dens, as the name suggests, connects the tip of the dens with the occipital bone or the foramen magnum. Remember, the apical ligament of the dens is considered as a remnant of notochord. This is regarding the apical ligament. Apart from the apical ligament, we have two alar ligaments which connect the base of the odontoid process to the medial surface of the occipital condyles. These ligaments are also called as the check ligaments. Why do we call it as check ligaments? Because these ligaments prevent excessive rotation of the head or the neck. Right? This is regarding the lateral ligaments or the check ligaments. Now once we have learnt about alar ligaments, the third ligament we have here is the membrana tectoria. The membrana tectoria refers to the upward continuation of the posterior longitudinal ligament which binds the axis with the occipital bone. These are the three major ligaments which attach the axis to the occipital bone and hence the axial bone also gets connected with the occiput. That is the reason why when we talk about craniovertebral joint, even though we have the atlas in between, since the axis is connected to the occipital bone, we call it as the craniovertebral joint.